Choosing a hospital is a matter of life and death. Let's look at the worst hospitals in America, in our opinion. Today we look at Henry Mayo Newhall Hospital in Valencia, California. Valencia is about 30 miles north of Los Angeles. Henry Mayo is a 357-bed not-for-profit community hospital and trauma center. They provide a wide range of care through a number of services such as maternity, a cancer program, an advanced primary stroke center, and a wide range of inpatient and outpatient surgical services. So why is Henry Mayo on this list? Where to begin? The LeapFrog group publishes ratings for all hospitals in the United States. They work with panels that are comprised of the nation's leading quality and patient safety experts and establish standards to which all participating hospitals are measured against. Standard setting creates a goalpost for all participating hospitals to strive for and allows LeapFrog to include measures of processes, structures, and outcomes on their national annual surveys. Henry Mayo has been graded a D by LeapFrog. The hospital did not respond to LeapFrog, which, it's important to note, may lower the scores, but we have lots of other data to examine. For instance, Henry Mayo is the worst hospital when it comes to death from treatable serious complications. The average is 143 surgical patients that died for every 1,000 people with serious complications, and Henry Mayo tips the scales at 187. According to LeapFrog, sometimes after surgery, patients can develop serious complications while they are in the hospital. They might catch pneumonia, have a heart attack, or lose function in their kidneys or liver. These problems are serious but can be treated by a good hospital team. If the hospital doesn't manage the patient's complications correctly, the patient could die. They also scored lower than average, in some cases way lower, in things like safe medication administration and hand washing, and once again are the worst hospital in America for specially trained doctors' care for ICU patients, called intensivists. There are higher death rates in hospitals where ICU patients are not cared for by intensivists. Oh, and also they have the worst score on, quote, dangerous objects left in patient's body, unquote. The hospital has said since that, quote, the low grade by LeapFrog is because we do not participate in the LeapFrog program. The methodology used by LeapFrog is not supported by all hospitals and health systems. Furthermore, participation requires a significant investment in time and resources. Unfortunately, as LeapFrog is currently designed, our lack of participation lowers our grade. In short, LeapFrog penalizes those hospitals that choose not to participate in its program, unquote. Who's running this hospital? The CEO is named Kevin Klakenga, and he was named CEO in March of 2023. We couldn't find salary information on Mr. Klakenga, but his predecessor, Roger Seaver, made $827,852 in 2021. Keeping that in mind, the hospital laid off over 100 of its reported 1,800 workers in June 2023 to reduce expenses. The announcement comes on the heels of a March 20, 2023 unfair labor practice strike that workers held, claiming the hospital has engaged in illegal bargaining tactics as they push for higher wages and increased staffing. The hospital has disputed that claim. One surgical tech named Stacy Suarez, who is a member of the union that represents these employees, says some of the lowest paid workers earn under $17 an hour, and the management offered to boost that to $17.50, all while the CEO makes approximately $450 an hour. The same union, in an open letter to the hospital CEO, said, "Our wages lag behind every other hospital in the area, forcing workers at Henry Mayo to leave the hospital or work second and third jobs to make ends meet. These poverty wages have had a negative effect on not only workers' lives, but the greater Santa Clarita Valley community. Low wages lead to high turnover and burnt-out workers, hurting the quality of patient care. In order to ensure the highest quality of patient care and safety, the hospital must invest in these essential workers." The website VisaliaTimesDelta.com has a hospital compare feature, and they give Henry Mayo a 2 out of 5. Some alarming statistics from this compare tool is that the, quote, room and bathroom cleanliness, unquote, has a rating of only 2 out of 5, as does the metric of whether patients understood their care when they left the hospital. There are some good metrics in all of the analysis we've done, but we're here to expose the worst of the worst and to encourage you to do your own research when looking for medical care. We looked at reviews from employees on Indeed, and there are some favorable ones, but some sounded like this. The staff is rude, the doctors rush their surgeries, and the people working there are racist. Wasn't my cup of tea, I couldn't wait to stop working there. The ortho doctors do not have good technique. I would never recommend anyone to go there, even if it's trauma, go to another hospital. The only good thing about Henry Mayo is there's a lot of parking spaces. We realize this is just one review by a possibly disgruntled employee, but Glassdoor.com, which allows for employees to anonymously post about their jobs, shows that only 52% would recommend Henry Mayo to a friend, and only 27% approve of the CEO, although it's not clear if that refers to the new one or his predecessor. To add insult to injury, on May 30th, 2023, the hospital had to issue a statement about a HIPAA breach that occurred on May 8th of that year. An employee accessed the medical information of some patients without a business need to do so. The data was demographic and clinical in nature, and the determined cause was, quote, curiosity, and the data was reportedly not used for any illegal purposes. Finally, let's look at Medicare.gov. Henry Mayo has an overall star rating of 2. That rating is based on how well a hospital performs across different areas of quality, such as treating heart attacks and pneumonia, readmission rates, and safety of care. They also have a patient survey rating of 3 of 5 stars. That measures patients' experiences of their hospital care. Recently discharged patients were asked about important topics like how well doctors and nurses communicated, how responsive staff was to their needs, and the cleanliness and quietness of the hospital environment. So that's Henry Mayo Newhall Hospital. Stay tuned for more episodes on the worst hospitals in America.